Marfan syndrome. Marfan syndrome gets its name from Antoine Marfan, who was a French pediatrician who first observed the disorder in a little girl who had abnormally long fingers and limbs. He made his discovery in 1896. Marfan syndrome is inherited as an autosomal dominant condition. Dominant genetic disorders occur when only a single copy of an abnormal gene is sufficient to cause a particular disease. Autosomal dominant is a pattern of inheritance characteristic from some genetic disorders. Autosomal means that the gene in question is located on one of the numbered or non-sex chromosomes. Dominant means that a single copy of the mutated gene from one parent is enough to cause the disorder. A mutation or genes in the fibrillin-1 or FBN1 gene causes Marfan syndrome. People with Marfan syndrome generally inherit one normal copy of the FBN1 gene from one parent and one abnormal copy from the other parent. A healthy person has two working FBN1 genes forming working fibrillin-1 protein, which leads to proteins joining to make strong fibers. A person with Marfan syndrome has working and non-working FBN1 genes, turning into altered or too little fibrillin-1 protein, leading to fibers that are too few or too weak. Symptoms of Marfan syndrome include high myopia, dislocated lenses, and retinal detachment in the eyes, curvature of the spine, inward or outward growth of the breastbone, long slender limbs, flat feet, and claw or hammer toes in the skeleton. Other symptoms include spontaneous pneumothorax, where the lung collapses and needs to be inflated again manually at the hospital, stretch marks on the skin, dural ectasia and Tarlov cysts, where the sac containing the spinal fluid around the spinal cord is enlarged, sometimes causing nerve problems and pain. Effects of Marfan syndrome include asthma, crowded teeth, scoliosis, flat feet, sudden lung collapse, loose joints, lens dislocation, and extreme nearsightedness. A genetic test can be used to examine the gene responsible for Marfan syndrome. It's able to detect an error that causes the syndrome in 99 in 100 of those affected. In most cases, a diagnosis of Marfan syndrome will be made from the physical features and symptoms of the syndrome. The expected lifespan of a person with Marfan syndrome used to be around the mid-40s age group, but now extends into the 70s, which is comparable to the general population. This improved lifespan is mainly due to improved awareness of Marfan syndrome across health professionals. Patients suffer from things including heart disease, bone deformities, such as curved spine, eye conditions, crooked teeth, and collapsed lungs. Treatments include beta blockers or angiotensin receptor blockers to help manage problems with your heart. These medications can suppress abnormal growth of the aorta. Anti-inflammatory and pain medications, braces to help keep curves in the spine from getting worse, glasses or contacts to help correct vision problems, and lifestyle changes that include avoiding high exertion or contact sports. Mild to moderate activities such as swimming, walking, and bicycling are generally encouraged. Physical or occupational therapy to help you strengthen muscles and manage orthopedic problems and complications. Some people with Marfan syndrome may need surgery to correct the problems or complications that can happen. Surgeries may include orthopedic surgery to correct more serious problems with the skeleton and sternum, eye surgery to treat some complications including a retinal detachment, cataracts, or severe lens dislocation, cardiovascular surgery to correct problems with the heart or blood vessels. Current research. Genetic molecular research related to Marfan syndrome and other inherited aortic disorders is a priority at the Center for Marfan syndrome and related aortic disorders. Pioneering work in cardiovascular surgery has been followed by expanding research and practice in all aspects of cardiac care. At the Falk Center for Cardiovascular Research and the Donald W. Reynolds Cardiovascular Clinical Research Center, clinicians and researchers are pushing the boundaries of knowledge and advancing our understanding and ability to diagnose and treat Marfan syndrome and aortic disorders. Currently, through the use of modern research techniques and equipment designed for use in the field of molecular biology, they are involved in studying families in order to identify genetic changes that are thought to give rise to the Marfan syndrome and other related heritable aortic disorders. A summary from one of the patients who had Marfan syndrome. Julie was in her 39th week of pregnancy when she suddenly felt lightheaded and had severe chest pain. She was then rushed to the hospital and lost feeling in her legs. When she was admitted to the hospital, she was first treated as a woman in labor. Then, it was later discovered that the problem was not baby-related. She was given an emergency C-section. The doctors found that she suffered a type A aortic dissection and underwent a 9-hour open heart surgery, after which she spent 3 weeks in the hospital and she was diagnosed with Marfan syndrome. She later found out that her dad, brother, new baby, and brother's 2 children all carried the gene.